Thank you for joining us today. World Diabetes Day is observed every year on the 14th of November. The theme for this year is Education to Protect Tomorrow. In our midst today on our show, we have Dr. Afsar Fatima. She's working as a consultant at Bangalore Baptist Hospital, seeing adults and pediatric endocrine conditions like diabetes, pituitary and adrenal disorders, bone and reproductive health. We also have Dr. Benjamin. Dr. Benjamin has 17 years of experience in treatment for older adults, providing them with comprehensive care, including their rehabilitation and restoration to independent living. He has specialized training in internal medicine, pediatrics, and diabetics for older adults and management of falls, osteoporosis, and other ailments of older adults. Dr. Dominic is also highly respected among his peers as a lead author in many index journals and textbooks. We also have Dr. Suman Rath. Dr. Suman has 17 years of experience in pediatrics and 10 years of experience in endocrinology in Bangalore Baptist Hospital. She is specialized in the treatment of hormonal problems in children related to diabetes, thyroid, obesity, short height, puberty, etc. Thank you, Dr. Afsar, for joining us. Thank you, Dr. Benjamin, and thank you, Dr. Suman, for joining us on the show today. We'll begin with the questions. The first question is to Dr. Afsar. What are the various types of diabetes in adults?
Diabetes, as we know, it is a long-term health condition and it's on the rampant rise from the past several years. As of now, the worldwide prevalence is around 500 million population of diabetes, and only in India we can see around 77 million people suffering from diabetes. So there is a lot to know about diabetes. Diabetes is locally called as Madhumeha or Shakkar Kail or sugar by the local people. So it is basically to define diabetes, it is due to the altered glucose profile. Every individual has a preset or predefined glucose profile in their body. When this gets altered due to various hormonal imbalance or any other environmental factors or any insult, it might result in diabetes. So to define diabetes clinically or to label a patient as diabetic, usually we go for a blood test. So ideally, according to American Diabetes Association and International Diabetes Federation, if a fasting blood sugar, that is at least of 8 hours of fasting of non-caloric intake, if the fasting blood sugars are well above 126 milligram per deciliter, or if a post meal, that is at least 1.5 hours or 2 hours post meal, if the blood glucose levels are more than 200 milligram per deciliter, or we can go for a test called HbA1c, which is a 2 to 3 month average blood glucose reading. If it is more than 6.5%, at least for 2 occasions. Or if a patient classically comes to us with any diabetes symptoms like increased urination frequency, delay in healing of wounds, or unintentional weight loss, increased thirst, or any excessive burning sensation of feet, so we can suspect diabetes and ask for a random blood glucose, which can be done at any point of the day. If it is more than 200 milligram per deciliter, then we can label the person as diabetes. Types of diabetes, as we roughly classify, it is based on the action of insulin in our body. If insulin is well produced, but it is not functioning properly, then or there is some sort of insulin resistance, that is seen in type 2 diabetes patients. Usually type 2 diabetes patients are about 20 years of age. And if there is a deficit in insulin production from the pancreas itself, the pancreas is the actual source of insulin in the body. If it is deficient because of any autoimmune or immune mediated damage, it results in type 1 diabetes or insulin dependent diabetes. There are other rarer causes of diabetes. One among them is pregnancy related or gestational diabetes. Usually pregnant ladies, in their second or third trimester, that is more than 12 weeks, they have some sort of insulin resistance resulting in elevation in blood glucose levels. This is very important to consider because this type of gestational diabetes might harm the pregnant lady and also the child. So we try to keep a stricter glucose control. Very other rare causes are due to drugs like steroids or any other conditions like polycystic ovary disease, hyperthyroidism, etc.
Thank you, Dr. Afsar, for explaining so well about diabetes. My next question to Dr. Dominic. What is the burden of diabetes in older adults?
Thank you. I think it's a very important question. We're seeing an increasing number of older adults living with diabetes. Most of them would have got it through their adult life, or some of them develop diabetes in the later part of the life. It's pretty rampant and it's very much widely prevalent, both in urban and rural. There's a bit of a misconception saying that only the urban people eat well and get diabetes, not the rural ones, but that's not the case. We see it in both urban and rural. And it's quite prevalent. Most of my patients either will know a diabetic or or have patients who are diabetic or individuals who are diabetic. So it's quite rampant.
Dr. Suman, why do children get diabetes?
Yeah, children usually they get type 1 diabetes. That is, the insulin secretion in their body is less. Now, why is that? Because usually it is related to related to their immune system, basically. Because normally the immune system should fight the bacteria and viruses which enter our body. But sometimes the same immune system will attack their own body, their own cells. So then the insulin production becomes less. But again, the question will come, why is their immune system different from other children? That is very difficult to say because there are a lot of factors, genetic factors, then there are some environmental factors which play a role, and together they somehow leads to some altered immune system, then decreased insulin production, and then the child develops diabetes.
Okay. To Dr. Suman only, I'll ask this question since we're talking about diabetes in children.
Yeah.
What are the noticeable symptoms and when should a parent take the child to go see the doctor?
The usual symptoms the children get is excessive passing of urine. Children will be they will be bedwetting or going many times to pass urine, or they'll be drinking a lot of water and they will start losing weight. So usually parents come with the common complaints that they are drinking a lot of water, passing a lot of urine, and they are not gaining weight. Rather, the children have lost weight. And there is another dangerous symptoms which the children come with is vomiting, stomach pain, and they go into one kind of coma which is called diabetic ketoacidosis. They develop ketones in the body, which is an acid because of high sugar in the blood. So then they go into coma and they become unconscious and they come to the hospital. So these are the common symptoms. Yes.
Thank you, doctor. My next question to Dr. Afsar. What is pre-diabetes? How and who to screen for pre-diabetes?
Yes. So pre-diabetes, the word itself tells that it is a stage preceding diabetes. Okay. As soon as the blood glucose in our body increases, our body tries to compensate by producing more insulin. So, but still the glucose is not under control. It is in the intermediate range as defined by American Diabetes Association. So to label a person as pre-diabetic, the fasting sugars may be in the intermediate range like 100 or 110 to 125 milligram per deciliter, or if the post-meal sugars, if they are between 140 to 199 milligram per deciliter, or recently ADA has also included a HbA1c value of 5.6 to 6.4%. Usually these, why do we need to know about pre-diabetes? Because they usually are asymptomatic. They might have a family history, they might be of the age, or they may be overweight, they may be obese, but still they may not be aware of the diabetic condition. So all these risk factors, whoever possesses, we have to screen them. Also, apart from this, we have to see if there is any underlying comorbidity like cardiac illness, uncontrolled hypertension, history of myocardial infarction, history of stroke. All these patients might have an underlying diabetes also.
Okay. Dr. Benjamin, why is it important to treat diabetes in older adults?
It is important to treat diabetes at any age, but in older adults, diabetes is like a sweet cancer. It licks and bites every organ.
Mm.
Unfortunately, when people are older, I want them to enjoy the harvest of labor through the adulthood. But unfortunately, the disease sort of makes them go weak and weary and be in the hospital more often than enjoying in the community. So I think it's so important that we treat diabetes very effectively. And diabetes affects many organs. And simple things like, if your nerves are affected, that they may have more often constipation, stomach starts bloating, they're not able to eat, leg starts burning, they feel they're burning on pins and needles, their sleep is disturbed. When the sleep is disturbed, they're very groggy, they're snappy, they don't get chatty with their wife, they're snapping. So I think simple things which we take it for granted, and obviously they can't go to a social event, they think they can't eat sweets, so they feel ostracized, they want to be at home, they can't engage with people, so they feel lonely. So I think it's a chain of events that happens. And diabetes comes with two good, brilliant brothers, hypertension and obesity and heart disease. They're all musketeers who go together, the three musketeers. So I think it's all a combination that they come together. So it's so very important that we treat diabetes effectively, early, and make the function optimal. That means if you have diabetes at 40 years, you jolly good look after yourself. Don't say, oh, when I come to 60, I will start doing something about it. By the time the nerves are damaged or your kidney is touched or I don't know what it is, but I think I can't undo it, So it is so important that we treat very effectively.
An additional question as I was listening to you, doctor, for the caregivers, those who are with the diabetic patients, how do we approach, when there are mood swings, they're up and down. So how do we approach and take care of them?
Well, one of the things I do is I tell the patients to get their spouse or the family. Okay, I can convince a gentleman to follow the diet. If the spouse is not going to cook, jolly good man, one day he'll fight, 2 days he'll fight, I just forget about it. I think it's more a team, the family that comes together and works together. I think also educating, as the theme for this year's World Diabetes Program is to educate, access to education. I think it's so important that this video sort of reaches the nook and corner of everywhere. So I think educating the family and the patient about what diabetes means, what medicines to take, and more than medicines, I think the physical activity, the food is the biggest thing. We have a lot of prejudices and facts about food, and I can't tell a Punjabi to eat ragi. You know what I mean? He's gonna smack me and go. So I need to tell them the appropriate culturally how to adapt it, and also teach them how to use the local vegetables, the local fruits, to make sure they work on that. And also teach the caregivers how to look out for high blood sugar. Somebody is going to the washroom more often, drinking more water, looks like blood sugars are high, he's losing weight, as Dr. Afsar said a lot of things. Or if somebody goes into low blood sugar, that's always a worry and a danger among older adults. If they go a bit cuckoo, they talk something weird, they're not sinking, or it could be that their blood sugars are going down, they're feeling blurry. So teach them how to manage it, not to panic and those sort of things. And also encourage them, also the family, to make sure that they come for regular follow-up. Remember one thing, any chronic disease, they get depressed, they get bored. Why should I do all this? Why me? So it is so very important that you have a system which sort of lifts your spirits up when you're on a bad day. So I think it's more a team that works together and partnering with one another. That they feel that you're there to help them, but I think empower them, educate them, make sure that they manage in their home, in their clinic, or when they go to social event. It's a family thing.
Thank you, doctor. Very valid points. Thank you so much. Dr. Suman, can diabetic children lead a normal life in regards to food and daily activities?
Yes, definitely. They are counseled in such a way that they should feel that they are normal children. It's not that they have some major disease. And regarding food, we don't give a diabetic diet for them with a lot of restrictions, because one thing we should remember is they are growing children. They need enough calories. So we do not restrict any food, but yes, the portions are adjusted. The portions of food, it is regulated or adjusted. So there are food which increase your blood sugar very fast. And there are other kinds of food which slowly gets absorbed and the sugar levels are maintained well. So we tell them to have everything, but we teach them what portions to take. So they can go to any festival, they can go to parties. We also tell them, yeah, if you go to a birthday party, have the cake, but in moderate portion. And also they can increase the dose of insulin before dinner if they know they're having some sweet or cake. So that way they should not feel that they're deprived of so many food, and then that will lead to other psychological problem and other problems in children. And regarding exercise also, we teach them to have a normal activity. And if they want to take part in sports or any exercise, they are free to do that. But at the same time, they have to be careful about the sugars, because excessive exercise can lead to low sugar. So then they should monitor the sugar. They should have some snacks in between before exercise or after exercise. So that's how they can regulate the food and their activity without major restrictions.
My next question to Dr. Afsar. How does one prevent and manage diabetes in adults?
Yes, actually, most of it has been covered by Madam. So basically, initially we were in a glucocentric era. Like initially, only the blood sugars were taken care of. But right now, we are in the precision era. We don't just treat the blood glucose levels. We also treat the complications. We also treat any other comorbidities the patient is being suffering from. Also, we educate them along about their disease and how to manage them. So it mainly has 4 pillars. One is a healthy meal plan. The 3 times small meal with intermittent snacking, and then a plate method. Like we suggest at least 40 to 50% of the plate should contain non-starchy vegetables. 25% should be your cereals like rice or chapatis, parathas, or bread or pasta. Rest 25% should contain your proteins. So it's a simple way of following. And then the timing has to be very accurate along with their usual medication also. And they have to know, as ma'am said, what are the glycemic index and which foods are effective in keeping a uniform level of blood glucose in them. And the next is exercise. At least we suggest 30 minutes of moderate to high intensity exercise of at least 150 minutes a week. And it should be done uniformly over at least five days a week, not like one set at a time. And along with this is the usual medication. We have a wide range of medication now available. Those medication are not individualized. They can be tailor-made to any patient. Like if a patient has any cardiac issues, we can go for SGLT2 inhibitors or GLP-1 analogs or so. Apart from medications, the last and most important one is educating the patient about their health status, how to follow, how to manage, and how to make informed decisions.
Okay. So following the diet and exercise plan is important.
Yes.
With
Yeah.
right follow-up with the doctor, frequent follow-up with the doctors. Dr. Dominic, what are the feared complications? Many people have a lot of fear, complications of diabetes in adults.
Well, I'm afraid, as I mentioned to you, it's pretty a nasty disease. It does leave a lot of pain and suffering for one to endure it. It's just not worth it, which can be mitigated. Now, as Afsar said, we've gone past that age where we thought diabetes is all about sugar control. We know that they have a problem with the cholesterol and lipids and the proteins. And we also look at what is called as cardiometabolic. Look at the heart, the metabolic thing. That's more important. So I think the complications, feared complications are the heart, the kidney, the vital organs, the eyes, and the nerves. As I told you, sweet cancer, it licks and bites every part of your body. And also makes your body so sweet that the bugs are just having a party there because it's all biryani everywhere, in the urine or in the blood, wherever it is. So they freak out. So I think one of the things about diabetes is that you need to address it very early, very judiciously, very diligently, and consistently. I think that's a key word. Consistently come follow up and get things under control. The feared complications are the heart, I'm afraid, the stroke, kidney involvement. The commonest cause of problem kidney failure in this country is diabetes, and the nerves getting involved, the muscle weakness. So you name it and you get it. So I think that's what the problem of diabetes is, and it's one of the commonest cause of disability and pain and suffering.
Yes. So even if they have many years.
And the memory issue. Diabetics are more prone to what's called a vascular dementia, and
Okay.
it's very blunt and it's very nasty. And it's not a very pleasant thing to have memory issues with diabetes.
Yeah, okay. So, Dr. Suman, is the insulin injections lifelong for children? And I also have this question in mind. When is the earliest age, the age group of children, maybe in your experience, that you have diagnosed children with diabetes?
The minimum age group we have diagnosed is as low as 2 months. We have babies coming, 2 or 3 babies are coming, and they have been diagnosed as diabetes. Though they don't have the type 1 variety, it is a different kind of genetic diabetes, and there the treatment is slightly different. But yes, they can get diabetes as low as 2 months, 3 months, and older children. So regarding insulin, usually children have type 1 diabetes. So they need insulin throughout their life. And the whole family has to be told right from the beginning when the diagnosis is made that this child needs insulin lifelong. There is no substitute, there is no tablet, no sprays, or any other way to give insulin except injections. And it's not only once a day. In children, it is 3 to 4 times a day. They have to take, and basically all this is done is to keep the glucose in control, blood sugar in control, so that they don't develop future complications, nerve complications, complications in the eyes, kidneys, joints. So all this is done to prevent those complications. So and they need insulin daily, 3 to 4 times a day, but sometimes injections are not required. You can give it in insulin pumps. So there are different ways of giving it to cut down the number of injections. But yes, it has to be given lifelong.
Okay. Thank you, Doctor. Dr. Afsar, why is World Diabetes Day observed?
Yes, as we are in November, let's discuss a little about World Diabetes Day. Previously, we've heard about this alarming numbers. It's not shocking to hear that by 2050, one or two in every 10 people will be suffering from diabetes. So India International Diabetes Federation and American Diabetes Association were in panic. What to do? We are treating them with insulin and drugs, yet the numbers are rapidly increasing. So in 1991, they have launched as World Diabetes Day. It's actually a program and a campaign to increase awareness about diabetes worldwide. And it is actually free. And every year it comes with a theme, like you said earlier. This year, the theme is education to protect yourself in the future, in the tomorrow. Okay, so what is this theme? Every person actually has to get aware of their own self condition, their disease, and they have to be aware of the complications also, how to take informed decision when suddenly they land up in hypoglycemia, how to skip their insulin dose or adjust their insulin dose. The care start from home itself. Diabetes, as we say, 90% is self-care. Just imagine imagine two people with equal sugars and similar medication. One is well aware of their condition and well taught how to use insulin or any other drug, and what lifestyle modifications to follow, how to keep his health in check. The other is just taking the drugs regularly. After a couple of years or at least 2 to 3 years, you can see the difference clearly. One might end up in complications, cardiac issues, and one might still be healthy, living healthy. So this education has to be important, but where is it lacking? Most of our people in India live in rural areas, so they may ignore some of the information which they get from the health practitioner. They might not be aware, or they are always busy in their own work. They hardly get time to take their own medication also. So this global World Diabetes Day campaign is trying to increase awareness at a mass level and trying to give them access to various kind of information online, and it is free also.
Thank you, Dr. Afsar. My final question to Dr. Dominic. How does diabetes management alter the quality of life in older adults?
Well, I think you want somebody to be better, getting better in life or bitter in life. I think it depends on how they look at diabetes. If diabetes is going to cause them misery and pain, they're going to be miserable and they're going to be snappy and they're going to be, very crass and curt. But if somebody is doing well, they get on with life, they enjoy life and things like that. I think the most important message that has to go out is education, education, education. Make them aware that diabetes can be delayed if somebody is prone to it. Diabetes can be prevented in a lot of people with the lifestyle. All we got to do is watch what we eat. We have a lot of refined sugar in the market, and people just eat through the day. There's nothing like a lunchtime or a breakfast time. They eat all through the day. They eat when they're sad. It's like alcoholic. He's elated. He has a big drink. If he's sad, he's a drink. It's like that. They eat throughout the day. It's a horrible thing, and it's not pretty. We want people to be sweet in their attitude and less sweet in their blood. I think put it that way. I think that would be much better in terms of managing diabetes. But I hope the message goes out to people saying that it's education and it can be prevented, mitigated. Reach out early to your doctor, seek your doctor. And don't believe what other people say. How can, like Suman said, young people develop diabetes. Oh my God, how can young people develop diabetes? I think this doctor must be out of his mind or something. You know what I mean? So I think check regularly and go for it. We all spoke about reactive things. We want to do it proactively. Check your bloods every, if you're a young person, every 2 years or 3 years. And if you're a person about 50, every other year. So just make sure you service your car with being 5,000, 10,000. Why don't you spend some time on your health? I think that goes a long, long way in preventing diabetes and keeping them healthy and sweet in their attitude and less sweet in the blood.
Thank you. Thank you so much, Dr. Afsar, Dr. Dominic, and Dr. Suman for helping bring awareness on this subject, on diabetes, a very important subject, and we need to talk about it, and everyone needs to be educated about what is diabetes and how we can prevent and how we can have a good quality of life. We appreciate you for taking time from your busy schedule to be on this show today. If you want to reach out to us, please call us at 6364252164 or email to info@febaonline.org. Let's take care of ourselves and let's educate people on this World Diabetes Day. God bless you.
Thank you.
Okay.